Hey, everybody, thanks for joining us. We are on week 20, the instinctive response with the Auric program journey and instinct and instinctive responses. A lot of how we process the environment is through like our instinctual responses. Basically, it's the idea of our body, our emotions, even behavior. We have these like automatic responses that happen that's not processed by the brain or by the emotions. A simple thing is like if somebody throws something at your head, you don't sit and go, "Oh, that's going to hurt if it hits me in the head." You just move your head and then you kind of process it after the fact. And a lot of our mental and emotional processes are still kind of influenced by this or based on this. We have a response to something or we have a reaction to something, and then later it's like, why did that make me upset? Why did that make me angry? Why was I afraid of this? Why did I behave that way? Why did I not say what I was trying to say? Why did you kind of go through this whole thing. And part of it is social interactions, it's behaviors, it's not just like survival, like that thing being thrown at your head, but it's all kinds of interactions. And some of these we're born with, some of it is tied to our genetics, or just simply the fact that we're in a body and the body is trying to thrive in the environment. And then some of it are based on um, conditioning. The simple one is, you know, until you touch a hot stove, you don't really think about it. But once you've touched the hot stove, you get around the stove, you're a little bit careful, right? And so you could even take this a little bit deeper. You could say in a way that it's not just about the immediate needs of don't touch that hot stove, move your head out of the way of that ball or social interactions, but there's also a component of this that is tied to a karmic issue. I've told that story before that it was from Annie Besant, back at the turn of the last century. And she was talking about karma and the idea of karma. And, she likened it to cutting vegetables in the kitchen. You're cutting vegetables and you're not really thinking about it. And you're like, chop, 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 chop. And you're doing your thing. And then one day you cut your finger. You cut your finger pretty bad. And, it's bleeding, it's a mess, it hurts, it kind of freaks you out a little bit. And so, you see the blood there, and then the next day it's not bleeding, but there's the wound, there's a big gaping wound. And then, a week or two goes by and the wound's closing up and it's scarring over and, all these things are happening. And, the pain might be down, but it still maybe hurts to move. When you look at it, you see it, you remember. Then a year goes by and, the pain is gone. It's not really on your mind, but every time you look at that scar, you think of like, oh God, that day in the kitchen, that was such a bad cut. 5 years goes by, 10 years goes by, you look down, you go, oh yeah, this one time I was in the kitchen, I was cutting vegetables and this little scar, it's from that cut. And then maybe another 5 or 10 years goes by. And you don't ever really think about that incident in the kitchen. Even when you look down at your hand and see it, you don't really go, oh, yeah, I remember the day. So that experience kind of passes, right? But every time in the kitchen, you're a little bit more careful. Even though you're not recalling that particular situation or that incident, you're a little bit more careful. And we all have areas in our life where, you know, we don't really think about it, but we're a little bit more careful because of very old experiences. We might not even be able to put words to it, but you know, it's there. And even in the depths of our inner self, we have instincts, instinctual responses, ways that we move towards something that might be good, or we move away from something that might be bad, or we move away from something that has caused us pain or trauma in the past. We might not even know what it is, but it's there. And so the more that we can regulate the response and not just have them be in an agitated state, the more that we can actually kind of process and make choices. If we're trying to break patterns in our life, then the more we can calm things down, the more we can make choices based on processing it out and having a reaction rather than, or excuse me, having a response rather than just a reaction. Right? So it could be with the mind, could be the emotions, could be just behaviors. And so this is an aspect of that. It's complicated, but it's not. It's simple, but it's also complicated. It's not just like, oh, calm that down and we're good. There's a lot of conditioning that goes into these responses, a lot of conditioning. Things that we don't even recognize or realize, but they're there. And so this can affect a lot of different conditions that I have listed here that are more physical and maybe just a little bit emotional, but eventually we'll be talking about things where it's a little bit more like spiritual or deeper levels of psychological healing, but at some point. So anyway, we're going to be working the blend. Is it instinct response or instinctive?
Instinct. No.
Instinct response. I think in the book it says instinctive.
Yeah.
Instinct support.
Yeah. So it's instinctive responses and instinct support.
Okay. Yeah. And so let us begin by inhaling with our awareness on the left side of the body, the whole left side. You're taking nice, long, slow, deep breaths. And then move your awareness to the front side of the body, your face and throat, your chest, the abdomen, all the way down to the tops of your feet. The whole front side from your face down to your feet. The whole front side of the body. The right side of your body. The right side of your body, right side of your face and neck, your right shoulder, all the way down to the right outer ankle, the whole right side. And then the back side of the body. No, would you give? I think it's okay. The whole back side of the body, back side of the head and neck, the whole back, the hips, down the backs of the legs. On the back side of the body, And then just be still. Just be still, be aware. You're just being still. Yeah. Let's do the advanced approach. That was the standard approach. So you could do that daily. You can integrate that into another protocol, or you could do Auric stack with several other Auric programming, blends. So again, you're beginning to inhale. Your awareness is on the left side of the body, from the side of the face all the way down to the outer ankle. Whole left side of the body. Nice, long, slow, deep breaths. And now the back side of the body, the whole back side. Back of the head and neck, the whole back. The back of the hips, down the backs of the legs to the heels. Whole back side. The right side of your body, the whole right side of your face and neck, right shoulder, right hip, the outer part of the leg, all the way down to the right outer ankle. And you're on the front side of the body, the whole front side, the face and throat, the chest, down the abdomen, the front of the pelvis, the fronts of the legs, all the way down to the tops of the feet. And then pause and be still. You're just being still. Begin inhaling with your awareness on the knees, either the whole knee or the back side of the knee. where it bends. Move your awareness to the ankles. Your awareness is on the ankle. Bring the soles of your feet. Your awareness is on the soles of your feet. Just pause and let go. Let's begin again. Left side of your body, from the left side of your face, left shoulder, left ribs, left hip, all the way down to the left outer ankle. The front side of the body, your face, throat, chest, abdomen, all the way down to the tops of your feet. The right side of your body. Your awareness is on the right side of your body. You're taking nice, long, slow, deep breaths. The back side of your body. Your awareness is on the whole back side. Whole back side, back of the head to the heels. And then just pause and be still. Okay, you're just being still. How's this feeling? Oh, yeah, yeah. Yeah. Okay, so the last little piece, your awareness is on the brain. Nice, long, slow, deep breaths. Your awareness is on the spine. Your awareness is on your brain and spine both at the same time. The brain and soles of the feet, both at the same time. And as you inhale, move your awareness up above your ankles. As you exhale, down into the earth. Inhale up, exhale down into the earth. And then just pause and be still. Notice how you feel, your body, your emotions, Your thoughts? Any- Yeah. Samantha was saying big difference between the standard approach and the advanced approach. But, when you go back and you look at instincts, I mean, it plays a role into stress, it plays a role into our emotions and our responses and behaviors and social interactions and, getting triggered and, you name it. So let's go ahead and open it up into shares. You can unmute yourself or type in. We're going to do just the Auric programming for just a few minutes, and then after that, we'll do our normal Q&A. So,
I know, I don't think I've really ever really delved into this once, in particular, but I'm like, I want to.
right, it feels
Like,
nice, yeah.
yeah,
Yeah,
I'm like,
yeah.
I want to add this to my stacks. Like, this was, yeah.
The thing, like if you ever want to do a little mashup, is remember the class, the Healing Spirit, or healing, is that what it was called? Healing
Yeah, healing
Spirit?
spirit.
Yeah, so it had the different spirits of the planets, like the healing spirit of the sun, of the moon. This would be awesome with that class. Like, if
Would you do it before or after?
you like, so if you were working, say, like the healing spirits of the moon, you would do it, you can do it before or after. Like they're going to do slightly different things, but I'd say at first probably do it before and then go right into the healing spirit of the moon. But
And even with the standard approach,
yeah,
that would
yeah,
be like,
sure.
okay.
Yeah. Would definitely enhance it. Yeah.
Someone shared starting to feel the programs going deeper into the body every week.
Yeah. Yeah. It's really amazing. I mean, to go through and do each one week by week by week, like just very methodically. I never in a million years thought we'd do something like that. Yeah, I was always just kind of doing it on myself, a bunch here, a bunch here. But the way we're going through and you guys are doing this, I mean, it will change your energy body, it will change your physiology, it will help you to become like a better version of yourself. Like better version is not necessarily the right thing to say, more aligned or more appropriate version of yourself. Life hasn't knocked you down quite as much once you kind of go through and do these. And you'll notice your intuition keeps getting stronger and stronger as the weeks go by. Yeah.
Well, and I personally kind of appreciated that this one didn't knock me out.
Yeah.
I
Yeah.
feel like the advanced approach almost every single week. I'm
Right.
like, "Ugh,
Right.
I can do regular Q&A. Let me see. I mean, they're kind of quiet on the art program, but yeah, go ahead, Robert.
Hey, Robert.
I was going to chime in and say, well, this was a continuation of the weekend. There was yawning going with it. So
Yeah. Right. Yeah.
that's all I
How do
had
you
to
feel?
say. It felt good. I'm relaxed and just sort of like, I'll say in a daze.
Mm,
Uh, like, okay, I have to type something. Like, how do I raise
right.
my hand? I'm not sure, but I got there.
Yeah. And you know how, like, I mean, several weeks back we were talking about how, you know, going through and doing the processes, you're noticing that like how you're processing information in the environment and how is that going? I'm just curious.
Uh, I would say that every day's different. It's a new adventure every day. What I'm seeing and noticing, even things I recognize I'm not reacting to anymore, not to the
Hmm.
level I was. It's
Sure.
just like, oh, so there's that again. Okay, you know what? Next. Uh, I'm, things are going well. Let's just say it that way.
Nice.
Yeah. So
Nice.
thank you very much.
Yeah, good. I'm glad we're all participating with this.
Yes. The classes, the study groups,
Yeah,
everything in between, it's all bringing a big change in my life.
yeah, yeah.
And then we do have a share in chat as well, but if you guys want to start raising your hand as well for the regular Q&A at this point, you can go ahead and do that. Someone in the chat said, yes, my connection to my intuition is stronger and stronger every week. Thank you.
Good.
And I know I want to piggyback off what Robert was saying, just like as far as the reaction versus responding. Like, I just feel like that little distinction of like, I'm more responding and not reacting
Right.
as much.
Yeah.
Goes back to this instinctive one though. I'm like, I feel like that will
Mm.
keep nailing that in a little more. All right, well, someone said my chatterbox brain is gracefully quiet. Nice. And next week, guys, we are on week 21, which is going to be the skin. I think it's the augmentary, integumentary, that's
Integumentary.
the word.
Yeah,
Yeah,
yeah.
integumentary system.
Yeah, it's a word little use.
And also skin support is going to be your oil. And so have those handy for next week. And glad you guys could join us. Now we'll start our regular Q&A and go ahead, Denise, start us out.
Hey.
You'll need to unmute yourself.
I know. I'm so sorry. I keep doing that, Sam.
No worries.
I was hoping you could recommend something for depression. I'm just barely staying ahead of it, and then it catches up with me. That and I just wanted to ask one question about my nephew that's having some respiratory concerns, and he has a
Mhm.
low O2. Those were my two questions today.
What was the second part? He has respiratory issues and what else?
When they tested him, he has a low O2. I
Oh,
don't know.
no, too. Yeah, yeah.
And
Yeah. Has he been sick or like what's been going on with him?
stress. He's always under a lot of stress, I'd
Mm.
say.
Yeah.
And I think he's the one that when he was born, his one lung collapsed and the other lung collapsed. And I think he just has it's probably some trauma and triggers from that time
Mm.
period.
Yeah, and if he was having poor functioning lungs to begin with, either they're compromised or there's a little bit of scar tissue. How old is he?
He just turned 40 this year in February.
What kind of work does he do?
He's commercial refrigeration in North Dakota.
Okay. Oh,
So
wow.
it's pretty cold.
Yeah. Hmm. Well, I would say that looks like there's a lot of inflammation in his lungs. There's a bit of uh, anytime we talk about the bronchioles being in spasm, it's just a different way of saying like not good vagal tone, but specific to the respiratory system.
Okay.
And so that would also be like the strength of breathing. It's like not just inhale, exhale, but like how strong the breath is or how weak or diminished the breath is. And so some of that can be from the medulla, like back of the head where the vagus nerve comes out.
Okay.
And some of it is just because of, the inflammation. I would say that I would do two things for him. right off the bat. I'm not sure that it's going to resolve it all completely, but I mean, these things need to be addressed. Is for one, we want to reduce the inflammation in the lungs themselves. And, not just in the body, but in the lungs. And then we have the idea of the reducing the spasms in the bronchioles themselves. In here, you could use one oil to do both, and that would be German chamomile.
Okay.
German chamomile would reduce the inflammation. If there's a little bit of infection or metabolic waste, just whatever that needs to be cleaned up in the body that's impacting that, it would help that. But it is one of the oils that you can use to reduce spasms in the bronchioles. It's like what you would use with uh like COPD and things like that, like where it's a really difficult situation to address. And I would do that. I
Okay.
like that for him. And then the second piece would be to strengthen the respiratory rate. Basically, like, how, like, okay, you get a little bit of mucus in your lungs or something, but if your breath is strong, you kind of push through it even though the mucus is there, and you kind of keep breathing. And his breath looks diminished or weakened. And he probably has always had that. If he
Yeah, I
had
think so.
those kind of lung issues when he was young, he probably has never had a very strong breath to begin with. So, some form of thyme, red thyme, white thyme, I tend to use, like, myself, I use benchmark thyme. Cinnamon would do it as well, but I kind of suspect that the cinnamon might be a little too strong for him. And
Okay.
I think the thyme is going to increase the circulation of the bronchioles and the lining of the lungs and strengthen the breath as well. And so I kind of like that. Just those 1-2 punches, and he doesn't even really have to direct it anywhere. He could just be inhaling from the bottle, and it would probably be good enough.
Both
If
of
he put
those
his,
products,
what's that?
both of them, like the Tylenol
Yeah, I
and
would start probably at first, like the first few days, with the German chamomile, and then follow it up with the thyme, but I would still be using the German chamomile for a while. And he doesn't need to take them internal or anything. He could just do inhalation. So you could get like little tiny bottles and do it. Um, that would be the 1-2 punch. And the thyme would strengthen the breath, but also increase the circulation, the capillary circulation in the lungs and the bronchioles and things like that, which means you would have a greater potential for oxygenating the blood. You know, if there's scar tissue, I'd say let's see what this does. But if there's scar tissue, we'll probably need to use like helichrysum, have him inhale helichrysum. But
okay.
you don't have to do that all at once. Like I do the German chamomile and the thyme, see how he does, see how he responds. I mean, if he's having that kind of difficulty, I mean, he's also up in a place where he has to shake off the cold air and he's not up at altitude, right? I don't know what
I
altitude.
don't think he's up to altitude. I
Yeah.
asked him, about, yeah, I said, do you have asthma? And he said, I don't know what I have. He said, I almost hyperventilate, like he can't always get a strong breath. I think, like
Oh, he might
like
have
he's chasing.
asthma. Yeah, he might have asthma.
And his father had asthma, and
Yeah.
my son did, so I think,
Yeah.
so there's a
But
possibility, but
still, I
he
would,
hasn't identified
yeah,
it yet.
I would start with this. If there is a chance that he has asthma, the other thing is, again, from the health food store, quercetin. Like I'd put him on quercetin. I mean, you could do it no matter what, just because, but he's in a place where the air is cold. I mean, I've only been to South Dakota, and like in the wintertime, man, it was freezing.
Yeah.
And, North Dakota is even closer to where it's colder. And so, I mean, it was super cold. Oh my God, it was cold. And uh that's hard on the lungs. That's really hard on the lungs. If he's had a history of pneumonia, even though he might not have pneumonia now, things like green myrtle might be good over a period of time. But again, that's things we can visit as time goes by.
Okay,
I would still start him with the German chamomile and the thyme, see how he responds. And then from there, we can start fine tuning the things that uh, could help. I mean, quercetin would help, lobelia tincture would help. Um, you know, the other thing that, we look at it a lot of times as a respiratory issue, but sometimes um, not enough red cells maybe are being produced or they're not getting oxygenated enough. And it actually can be a kidney issue.
oh, wow.
And the body produces a thing called EPO. And sometimes the person's EPO is really like low production, and that can cause weird oxygenation issues and kind of hard to address like anemias and stuff like that. And so um, the thing that I've used with for treating asthma, because like he had a rough time in the beginning, and then like you
Yes.
said, he's in a place where there's cold and everybody around him seems to have asthma, and like you said, he's hyperventilating and having a hard time getting his breath. I'd also wonder if he wheezes a little bit.
I'll have to ask him about
Yeah,
that.
yeah, ask him that. And the thing to do, that pursed lip breathing, very good for
Yes.
people with asthma, so if he'd do that, that would be helpful. But the other thing is, if you're going to treat asthma, kind of my little formula is I like to use lobelia. I like to use quercetin. I usually give them like 500 milligrams or so of magnesium just because of the antispasmodic effect. And
Sure.
then I give them a pretty hefty dose of cordyceps. And it's one of those mushrooms that we use. But like athletes use that a lot because of what it does to the blood cells and the levels of EPO in the body. It elevates these things so that you basically, have like stronger red blood cells. You produce a little bit more red blood cells, and the blood cells are more oxygenated. And so it could be this like funky thing where it's not just that his lungs are not functioning. It could be that he's not producing very much EPO or something's going on. And so a lot of times when I would treat somebody with asthma, I would do a little bit of healing, but a lot of times I would let the supplements do it. And I would put them on the quercetin, the magnesium, lobelia, and cordyceps. And then, you can play with different oils. Hyssop's always a good one, hyssop decumbens especially. Um, but large, the things that we always kind of use to open up the bronchioles and things. Um, that combination, usually within 30 days, I would get people most times, not every time, but most times, I would get them off their inhalers. Like, I wasn't setting out to like, we're going to get you off this inhaler, but, the inhalers cause problems as well. And, one of the big things, if they've ever used inhalers, is it lowers the magnesium serum levels in the body. And so they start to have magnesium related issues and they'll start getting bad headaches and things like that. But it's just because like the body starts like going through these weird like tensions and things.
Oh,
And so, the more that we can get them off the inhaler, the better. But I let them and their doctor figure that out. I don't say you have to get off this. We start treating, and when you get better, you get better. And but that's usually what would happen. Within about 30 days, we get them off inhalers.
And
And mhm.
it would help that O2, that low O2 that he has going on.
Yeah, like it's either there's not enough circulation in the lung tissue, like the
Okay.
lining and the bronchioles, or I would say his kidneys are not functioning quite like they should, and there's like a lowered EPO. And so I suspect that that was happening a lot with people post-COVID. Um, it's hard to say because we didn't really have tests and everything, but we treated a bunch of different things with people that were having a hard time with getting their oxygen levels up in the blood, post COVID. And I never really found a thing where I was like, that's it, because I think there were so many different factors with different people. But if I had to revisit that, I'd probably throw everybody on cordyceps almost immediately.
Wow.
Being so far away from it, now I can look back and go, I probably should have worked that harder. It's hard in the moment because there's just so much craziness going on. You know what I
Oh, yeah.
mean?
Panic,
But yeah,
fear.
and you're trying to put out a fire rather than like thinking long term because some people it was like borderline like life threatening sometimes.
Yes.
And so I think different things did work, but I like the idea of cordyceps for him, but more of a long-term resolution. Like right off the bat, I would still do the thing that we talked about, thyme, German chamomile, kind of get it kind of stabilizing a little bit. And then after that, we could start looking. I mean, it kind of sounds like you might have asthma.
Yeah.
And definitely couldn't hurt even treating it, even if you didn't. You know what I mean? But try that first and see how that goes.
Thank you. That's
And
wonderful.
the other thing, especially with somebody who's not like, when we're doing classes and things, we're used to like really going at something. When you got somebody who's like a family member or a friend or something, you want to overwhelm them with like a whole bunch of things to do. Give them like a little bit and then, okay, start trying this. Like I have my cousins going through something and I gave him just one or two things to do. And I was like, do this. And then in 3 or 4 weeks, we'll talk about like the next level. If I gave him everything all at once, he,
Yeah.
he would probably not do any of it. So, I give him a little bit, let him get going on it, and then go, okay, now here's another bit. And you might have to do that with him just because, they're just not used to doing, holistic stuff is usually a lot of repetition, trying to break the bad repetition in the body. So you have to be kind of consistent with things for a little bit. And in that consistency, I like to kind of rotate things, but there is this like kind of constant effort that somebody needs to put in. And the general population, I would say, they're not used to that. So let them digest that little bits at a time.
Surely. Thank
Yeah.
you. Thank you.
So in the depression, like you
Yes.
just like you're tired, you're run down, a bunch of difficulties in life.
I'd say just kind of capacity for like about 3 weeks. And I think it's probably an accumulation of the last 3 or 4 years. And for some reason my nervous system and just yeah, I'm just very from I don't quite know how to describe it.
Like, do you feel hopeless or you just feel like blah or like what kind of things kind of go
Uh,
through your head?
well, kind of paralyzed, somewhat
Paralyzed.
paralyzed
Okay.
feeling, I want to say.
Yeah.
And I don't know if it's hopeless. I think that's just it. I'm recalibrating. I'm
Okay.
kind of down and I'm
Yeah.
recalibrating a whole lot of stuff. And so it's like kind of above me still. It hasn't
So
completely dropped in what it is.
the reason why I asked the hopeless thing is that sometimes when the spleen gets really depleted, you get to the place where you don't really have the energy to like feel. You know what I mean? It's like there's just like the blahs, or you feel like you said incapacitated, but then there's times where you just don't even have the energy to feel. And if somebody goes, "What do you think about the future?" You're just like, what's the point? Or I don't think anything good's ever going to happen to me again. Or that's usually a very, very depleted spleen.
Okay.
So you don't sound quite there. I mean, incapacitated is there, but that sounds a little bit like maybe nerves and a little overstimulation and maybe even a little bit of brain fatigue. When I
Yeah.
look at you, the brain is a little bit depleted, but that can just be fatigue from not getting a couple good nights sleep or something. You know what I mean? But when if it's been there for a long time, so the thing that I would say is I would inhale sage, especially Spanish sage, but whatever sage that you have. And I would do a body tonic of Spanish sage and just put it on the body. It would help calm down the sensory nerves. It would, kind of stimulate healing processes in the body. It's very fortifying and kind of I don't want to say invigorating. Invigorating is not the right word, but it's like it kind of raises your constitution a little bit. Like it makes you feel like you got a little more juice in your legs. You know what I mean? And the thing too is it is used to treat depression, and it is one of the better things to use for brain fatigue. And I think you hit a lot of marks, on the checklist there of going through and treating things. Um, if it was depleted spleen, you could use more like thyme and angelica, and even the use of cinnamon. The idea of cinnamon is that it can be very fortifying to the body. And there's like this old medical aromatherapy thing that gets said that cinnamon doesn't know depression.
Nice.
I would say cinnamon doesn't know certain kinds of depression. Like there's some where it's like but it's fortifying and it makes you a little bit more outgoing. And a lot of times if you look at like more like emotional or mental forms of depression, a lot of times it's too much being turned inward. Like, you're going a little bit more to inward and there's not a lot of outward expression. And it could be, you don't feel hurt, or you could be a little upset, or, it could be a little bit angry about something or somebody, and you're not feeling that somebody is listening to you, whatever it might be. And cinnamon can be very good for that kind of depression. And even just the depression that comes from body fatigue, your body's just worn down.
Right.
So, I would keep that in mind, but I still like the idea of the Spanish sage. The thing with cinnamon too is it also will help brain fatigue. And so, you could go back and forth between the two. Thyme could be in there, sometimes angelica. Like I like to use angelica when I'm starting to feel a little blah, but I if there's anger present, because a lot of times it is like a repressed anger for some of the really deep kinds of emotion, and it doesn't have to be necessarily at a person. It could just be all the crap that's gone down. You know what I mean? Like you
Yeah.
just really another thing on the list, like just one
Yes.
thing after another, right? And so Melissa's very good for that. Chamomiles can be very good for that as well, especially Roman and Cape. Um, Melissa is very, very fortifying as well. Like I would say the thing with Melissa is it's a little bit more for like melancholy. And you do sound like maybe it sounds like you have reasons, but it is like a little bit of like,
Yeah. It's,
versus like that person, or like, I don't want to talk to you. I don't want to, it's just,
I'm tired of the fight. I'm very
yeah.
tired of the
I,
fight.
I used to like, this is really kind of a derogatory thing for me to say, but there was times in my life where I was like, go ahead, kick me in the nuts again. Just seems like one time after another. And you know, that would produce I would go through melancholy when that would happen. And Melissa's really good for that. Really good for that. I still would probably partner it with sage, but you know, you could do the tincture, you could do like a couple of drops internally, and it probably doesn't have to be like a long-term treatment. But the thing that I would say about Melissa is Melissa really, it helps the heart take a punch. Like you know, it's like, you know, the heart just feels like resilient enough to where that when the difficulties just keep coming at you, it's like you use Melissa and you're like, okay, I might not like it, but I can handle it. I can take it. Where there's been times in my life where I was like, I don't know that I can take it anymore. Like I'm on my last nerve. I'm hanging by a thread. And um you know, there wasn't anger, there wasn't anything, but I just felt like I couldn't take very much more. And the Melissa really pulled me out of that. And back then I wasn't even using the essential oil. You know,
Well,
we couldn't find essential oil like that in the US back then. So I was just taking like crazy amounts of the herb, like just mass amounts of the herb. And it would pull me out of it, you know. Um,
thank,
so uh,
um, I have, I have Spanish sage body tonic. I don't have the
perfect.
essential oil, but I do have the body
No,
tonic.
that's perfect. And if you have,
I have
so
Melissa.
put the body tonic on, take Melissa internally, and inhale. Just find some other sage you have in one of your kits and do inhalations. Excuse
Okay.
me, with that. And that combination, I think, is a good start for you to treat the depression and the blahs and the melancholy and all that.
And I have, I just bought the Thyme, you know, you
Oh,
thought that would
beautiful.
be good for
Yeah,
me.
you
You
could throw
thought
that
that,
into the mix.
and,
Yeah. I mean,
the,
you don't seem to have
okay.
like anger about anything, do you? Like, are you upset or angry about it, like at night, or like when you have your moments where you're like, ugh, you know, not just like a little bit. Like everybody might have a little bit, but I mean, like it really is gnawing at you. You don't seem
Um,
to be
it's
going
more
through it.
sorrowful. It's more sorrowful.
More
I'm just
sorrow.
tired of the
Yeah,
fight. Yeah.
do the things that we talked about then. Yeah,
Yeah.
yeah, that could be good.
Thank you
Yeah.
so much. I
Yeah, you're
really
so welcome.
appreciate it.
You know, with the sorrow, I mean, margarine can be helpful, rose can be helpful, but a little, I'm sure you have in one of the kits, the ginger lily. Just inhale some ginger lily from time to time too. No,
Excellent.
it's very transmuting to like sadness and grief and sorrow.
And
Yeah.
I did get a little roller ball of the jasmine too.
Oh yeah. Yeah, yeah.
So
That
I'll,
can be fortifying. Yeah.
I'll get all that stuff put together in
Yeah.
a little
Put all
basket.
that together, put it on your coffee table, and every night have a party. You
Okay,
know.
there you go. Thank you so
You're
much.
so welcome.
My heart thanks you. Okay,
Yeah.
have a great trip. All right.
Thank you. Thank you.
And go ahead, Ralph.
Hey, hey.
You should be able to just go right ahead and unmute yourself tonight. Let me see if I can help you though. While he works on that, I'll go ahead and go into some of the chat questions.
Mhm.
Where can we use clary sage for depression or sage?
So with the sage, I mean, applying it to the body, especially Spanish sage can be helpful. Clary sage is not a true sage. It doesn't quite have the same properties as sage. Clary sage is really good for reducing stress, though. I would say really, really good for reducing stress. One of the better choices for reducing stress. And it also kind of helps like go a little bit more into the intuitive mind. And so it will kind of break you out of your head a little bit, like when you're really in a loop or you're really into like some story of what's going on. Clary sage can be helpful for facilitating that. But the regular sage and Spanish sage is very good for like the physiology that would be associated with depression. And so, like the idea of chronic fatigue syndrome and fibromyalgia, like when they're in a crisis, I've used this for, I don't know, 20 years or so, where, I would take um, a body tonic of Spanish sage, and make it real strong, like how we do it, and have them shake it up and just rub it all over their body. And usually within a couple of hours, like something that might have been going on for weeks or even months, within a couple of hours, they start pulling out of it. And it's just because, sage and Spanish sage, they're like a cure-all. Like they help stimulate body's processes that even things you wouldn't really think of, and things that are more than just a symptom-oriented approach. It helps the body to relax. It calms down the sensory nerves. It starts addressing the brain fatigue. It's calming and soothing to the nerves, and at the same time, kind of fortifying. And so, the more that you kind of apply the Spanish sage over a period of time, the greater potential you have for diminishing depression and even preventing depression. Like I use it sometimes just because to prevent brain fatigue from having such a busy schedule. But like I'd use it to try to offset, like if I'm starting to feel fatigued, not just like, oh, I'm tired at the end of the day, but how like you're going through and you have schedules and deadlines and things that you got to do, and you wake up and even though you got a really good rest, you're like, yeah, I could use another few days sleep. I could really, I need a day off or something. And so I started using it to prevent the potential for something to be going south a little bit with the fatigue and the effects of fatigue. And so I usually kind of, I wouldn't say it's like it raises my energy levels massively, but it gives me more like strength or endurance. And I noticed that my emotions aren't as fluctuating as time goes by. Your emotions will start to fluctuate when you get a lot more tired. And so, there's like a kind of a current that goes through you. And when you get fatigued, man, they start flowing. And so it really helps with that. If things are going on where a lot of the depression is just difficulties in the environment and you're stressed out, or you're really locked into like thinking something, like you're having a hard time breaking out of this situation, this person, and you have a hard time breaking up, that Clary Sage could be helpful for that. For a while, I was using a combination of Melissa, Clary Sage, and neroli for people who are even starting to go into the dying process, just because they're not just making the physical transition, but for a while they're kind of transitioning from life is a particular way and now it's different, like life is winding down, and having a difficult time letting go with different parts of their life. My great aunt was one that she was just having a hard time with it, and I started giving her some of that combo, And like within a week, she kind of came to a place where she got kind of present with, okay, this is what's happening. Started making her peace with people and situations where before, she was talking about, in 5 years, we're going to go on vacation and go do this. And it was like, you know, you're probably not going to make it a month or two. She was really winding down, but it broke her out of her story, so to speak. And so I like Clary Sage for that. I mean, I probably personally should use Clary Sage more than I do, but I do like it. I just sometimes I forget about it. And so it can be helpful with things like that. But, it depends on the kind of depression. Again, if there's a lot of anger, Melissa and chamomiles are quite helpful. If there's melancholy, Melissa is quite good. Cinnamon is always kind of good for certain kinds of depression, especially if there's a lot of body fatigue or you're having a hard time with expression or, you're just too turned inward. And so that can actually be quite helpful for that as well. Even different times, they're fortifying, not quite as much as the cinnamon is, but still fortifying enough. So
And was that a blend you were saying about that, the neroli, the clary sage, and I missed it, but
yeah, I mean it was a blend that I made. I mean I can make that. You know what's really close to it is that blend katumi, the one of the deities. It's those three, and it's also got some basil in it. And so even when I made that, after I made it, because I'm not setting off with an intention, I just started making, looking at something, measuring it, and then afterwards I was like, huh, kind of close to that blend I used to use, way back in the day. But if somebody wants something like that, it's just equal parts of all three. It wasn't anything fancy or anything, but yeah, yeah.
and then go ahead, Ralph, then Linda.
Hey, hero.
Hey, Greg. Still working on with the family who's got the 3-year-old that's still breastfeeding. You
Oh,
had
yes.
suggested peppermint or Spanish sage internal.
Mhm.
Somebody in the family is reluctant to do anything internal right now.
Yeah, I don't blame them. Yeah.
So is there something, because the mother is apparently in her second trimester, is there something we can use topically which
I mean,
may dissuade?
you can try doing the sage topically, the Spanish sage. I would definitely do Spanish sage with,
Okay,
just because the other sages are a little too strong.
yeah.
You can try doing it topically.
So yeah, so they were thinking about using coconut oil and whatever oil and then do it topically to, would that
You
be a
could
good
try.
carrier?
Yeah, you
Okay,
could try. Yeah.
okay,
I mean, even when I was thinking it out, I was like,
yeah,
I'd probably do the Spanish sage before I do the peppermint, but going back and looking at my notes, um, peppermint is probably a little bit of a stronger choice because like people were even having issues. I did a deep dive in my old notes, and there were stories of people even like with peppermint toothpaste. Um, and they were not wanting the milk to be shut off and it would stop flowing. And so,
okay,
you know, I'd start with the Spanish sage, and then if that didn't work, even if you maybe do the peppermint as a gargle or something like that.
mhm,
But I hear you on the thing about, you don't want to do too much because she's pregnant and she's nursing, but
yeah,
if you're really trying to wind it down, try that topically. Even if you put like peppermint, like maybe on her low back or something, like just a drop or two, and then rub it in with some coconut oil or something. I mean, I would give that a shot. It doesn't have to be necessarily, like on the throat or on the chest or something.
okay.
Yeah.
How about somebody, the grandmother specifically asked about, oh, Julie. because,
What is it?
patchouli oil,
Patchouli?
because
Um,
patchouli is so, most people kind of react negatively to it. So they were wondering if they use
let me,
patchouli with a little bit of coconut oil as a carrier or to reduce it
and you're talking about for reducing the,
so that the youngster will not be so as
Oh, yeah,
attractively
if the
dressed.
baby, like the 3-year-old just doesn't want to like come close, I think was what the grandma's thinking.
oh,
Right. Yes.
Oh.
Is there, so is the patchouli going to be a negative for the, because
the
the
only
kid
thing that I
might,
would say, like, I get where you're kind of going with that. Like that, huh. The only thing that I would say is, the mom going through the pregnancy and then, not so much about the one that's already born, but the pregnancy that's happening is patchouli does jumpstart all of the hormones, and the body's already doing whatever it's doing with the hormones. So I would
okay,
be, this is the difficult thing when with a pregnant woman is like, it's a different animal.
okay.
Um, I kind of like that idea though. Like if she, if the child stops trying to nurse, then it would probably stop.
Mhm.
Because
Uh,
that's the thing, if the little 3-year-old just isn't taking milk, the milk's gonna dry up
right,
naturally.
right. Mm,
But the issue is the sense with the fetus, so.
yeah.
Yeah.
Huh. Um, what could you use there? Kind of an interesting idea.
I mean, I'll definitely say Spanish sage and coconut oil would be our first choice.
I mean, that might be like weird enough for the child that like,
Yeah.
you know, like I'll share my little story. Not that this is going to, but I don't know. We were up in Chicago or something, and we were seeing friends, and we were jumping into an Uber to go somewhere, and I had just put on some like really super fancy Spanish sage, and as soon as we got in, the Uber driver was like, you could tell he didn't like it, and he sprayed like super cheap cologne in his hand and just kept breathing the super cheap cologne, and it was like, why is he doing that? And then it dawned on me, it's the Spanish sage.
Mm.
And he was like moving his head side to side, and you might be able to get it with the Spanish sage.
Well,
Just
Okay.
I don't know if this would be an option, but we have the infants and children's kit. I mean, some of those oils like thyme linalool, like the little kids, like
yeah,
probably would be a deterrent. It's a soft
yeah,
one. I don't know.
yeah,
I'm just
yeah.
speculating, but
Maybe the Spanish sage, or like she said, thyme little or something, just like a drop and just rub it on the like where it's going to be really close, and the smell might be and enough to
Yeah.
keep the child away. Yeah.
Okay.
Yeah. Yeah, it's a
All
good
right.
idea. It's a good idea.
All right. Well, that gives us some options, so I'll suggest
Yeah.
those and we'll see what happens. All right. Thank you.
You're so welcome.
and go ahead, Linda.
Hey, how are you?
I'm good, and actually, I'm here tonight not with a question, but with a testimonial.
Oh, you're so sweet.
Well, it's really amazing. I'm finding certain protocols that I like when something's happening, that's what I do. And just this last couple weeks, um, I remembered that the vagus nerve needs support and balancing sometimes, even when life's going okay.
Right.
I start to get these symptoms, which I'm now noticing. It's like, oh, those are my symptoms for that thing. So the my symptoms are I start to feel like uneasy about going out in the world. I'm starting to get jittery for some unknown
Hmm.
reason, and I get this weird thing in my throat where I feel like I'm having a hard time swallowing, and and my breathing is compromised, and there's like
Hmm.
weird set of symptoms that I get. And a couple weeks ago, I thought, oh, I wonder if it's my vagus nerve that's causing this.
Hmm.
Oh, I went to the vagal class, the class on the vagus nerve, the spiritual and physical
Hmm.
aspects of the vagus nerve. And I did the stuff with the tarragon, and I used the anise, and I did the cycle with Splendor and Gordog, what is it? Gordalo?
Oh, Gordalgo.
That
Yeah.
one, and
Yeah.
Inula. And lo and behold, the very next day I was like, oh, my swallowing thing isn't being a problem, and I'm fine about going about my day. And it was just a really good reminder, that
Oh, so good. So happy for you. Good.
yeah,
I
yeah,
mean, like that's the thing is like at first just getting vagal tone to go in the right direction, but then there's always these little areas where there's a mop up that needs to happen, but in a specific area, not like the big general. And uh we're gonna go through all of that in that free class on Father's Day weekend, and we're gonna just look at all the little nuanced areas of where vagal tone is hiding and lurking, where there might be an issue. And so yeah, I like that.
yeah. I just so appreciate all the work we're doing, but all of the ways that I'm starting to connect the dots for like the things that show up in my body. And it's like, oh, what's that? Oh, Greg would have said something like this.
Yeah,
And then I can go and find the thing that I need. So thank you. I just wanted to
you're
share
so
that with
welcome.
you.
I'm looking at you. Where you could even spend a little time is the inner ear. And do you happen to have like dark blue tansy?
I know, I don't think I do.
Why don't you try, let me look. Maybe vetiver might work.
Oh, I have that.
Yeah, let me look at the my notes here.
Okay.
Like, so when you're going out, like, do you get anxiety, or like what happens when you're going out, or
Well, okay, so last year I finally hit on to the fact that I actually had agoraphobia. And so I started treating myself for that, and that really like knocked it back a lot. But what happens is I'll start to feel like I'll start to think about all the negative possible things that could happen when I go out. And it's like, I don't
okay,
think about those things, right? It's
yeah.
like I'm just going out and doing my thing and all of that. So
That used to be my middle name.
really,
Oh my God. Like it wasn't even about even going out. It could be give me a project or something. I could tell you all the things that were going to go wrong.
yeah.
Like, it's
Yeah, so yeah, the way it manifests is that it's like I start to find that, my heart might get a little fluttery when I start to walk out the door, like, oh, something might happen. And it's like, there's nothing gonna happen. I know nothing's gonna happen. Um, or the thoughts will be strange. But really, like this weird thing that happens in my throat is the most disconcerting because it really feels like I can't swallow right. It's not swallowing smoothly, and
yeah, especially the anise should help with that.
it
Like
does, it really
inhaling
does.
and gargle and a little bit
Gargling,
internal.
yes.
So under like because I would put that as like not just that something bad might happen, but there's probably a little bit of just like the social interaction of it all and just, being around people and, that kind of thing. It's non-specific, but so I would say tarragon, benzoin, or rose, which, we use for those things a lot. But in that, do you happen to have benzoin?
I don't know that I do.
Okay, so if you don't, use tarragon or rose
Yeah.
and do, how we do the brain spine, brain soles of the
Uh-huh.
feet. Do it, but in reverse. But instead of the soles of the feet, do the perineum, the perineum,
Okay.
so start there and really linger there for a little bit. And part of what happens is when you work that area for a period of time, especially with, tarragon, rose, benzoin, you're inhaling and you're keeping your awareness there. It For one, it's helping to relax how we exchange energy with like the earth and even like other people a little bit, but it starts relaxing the spine.
Mhm.
And then from there you go up and then start inhaling it on the spine and just really deeply like linger there for a while. And if it's hard to keep your awareness on the whole spine, do it in sections. Start low and then kind of work your way up high. And then from there, then hit the brain. And then if you wanted to, after you kind of do, it's almost like doing the work programming, but in reverse. Like so
Mm.
you're doing from the bottom, then you're doing spine, and then you're doing the brain, and then do the four quadrants.
Oh, okay.
And just see, like experiment with that and see if that helps you a bit. And uh like I do that I don't do it daily, but I'll do it for a few days. I was like, this feels amazing. And then
Mm.
I'll stop doing it for a while. And then, because I'll feel good and then I'll come back and it's like I don't necessarily even feel like I backslid, but it's like, like you have thresholds and you have a pain threshold or whatever, but I also feel like sometimes like I hit like a threshold of like, okay, I feel so good. I don't know that I can handle more. And like I just gotta let this integrate, because you are shifting a little bit. And so then I was like, okay, I'm just gonna let this set for a little bit. And then a little bit later, it's like, okay, now I can go a little farther. Um, so I would experiment with that and just see how that is, especially like when you're going to go and interact out in public. And, social doesn't necessarily mean like socializing, like, hey, we're going to meet and have coffee at, Starbucks or whatever. But it's just being in around people, going in and out of stores, standing in the line, picking up the little social cues and, social distancing, all that little stuff
Mhm.
can be a little overstimulating, or that can be a little bit those mechanisms can be a little like agitated. Like you said, like something bad's going to happen, something's going to happen, and it just keeps like kind of calming those things down. And when you get up to the brain, if you want to like explore it a little bit deeper, do the brain and then do the forehead back head at the same time,
Mm.
after you've done the brain for a while, because you're still kind of hitting into the nervous system up on the forehead. And I'd still do those things that you just did, but you don't have to do them all in one sitting. I'd just kind of keep rotating them a little bit. But I think you could probably keep taking a little bit deeper into the body by doing that.
Mhm. Mhm.
Yeah.
Cool. Thank you.
Yeah,
Yeah,
you're so welcome.
I'll definitely add that in.
Yeah. The thing with the ear,
Oh, yeah.
it's the inner ear, is you could try vetiver. In my notes, I just have dark blue tansy. I don't know that it's going to make a big change in the things that you're talking about, but the reason like I like to go to the inner ear for something like this is, we have those muscles, those two muscles that come from each side of the sternocleidomastoid. And when they're tight, they do throw off the inner ear, and they can throw off the breath, and they can even throw off the gut and all of that. And so, we work it from one direction, but one of the things that they do, especially the clavicular head, the one that goes to the clavicle, is it throws off the inner ear. And so the idea is to almost like treat it in reverse, like go to the inner ear and start unwinding it. And then it opens up the neck. And in the neck, the breathing becomes a little more regulated, the digestion becomes a little more regulated, the diaphragm, it's almost like doing a reverse engineering of something. And in the old days, you could use like a little bit of valerian every night as you go to bed. And if you do it for 30 days, it will reset the inner ear. And in like probably the 80s, they used to give a really low dosage of Valium, which is synthetic valerian. That's all Valium is. It's synthetic valerian. And they would give like a 2.5 milligram, which is a real low dose, but they would give the person and have them take it every night at bed for 30 days. And it was to reset the inner ear. And so, we don't really think about how if the inner ear is off, it makes us feel like we're not safe or secure. Like,
Yeah.
like your balance isn't like it should. And so, you know, you could be having these emotions or these feelings, but it's not about the environment itself. It's just like something feels a little bit off, and the body is like, we don't have the greatest balance. We don't have this. We don't have that. And so, we really don't think of the inner ear as being a cause of like anxiety and fears or just agitation when we go out in the environment, but it can be, and so, um, even, doing like try the vetiver, see if the vetiver works. Do like the jaw and the ear. You could do the forehead, crown, forehead, ajna, but then the jaw and the ear, and see if that helps, and see if that reduces that feeling when you go outside.
Okay,
Yeah.
cool. Thank you. I will give that a try and let you know.
I've had a couple of clients. It was a very long time ago, but they would say, I feel like I'm gonna die. Like I'm about to die. I just have this weird feeling I'm about to die. I treated all kinds of things. I treated the inner ear, and that feeling went away.
Wow.
It's not every time, but it's like a thing to like, well, if you're having a little bit of a phobia or a little bit of like, I don't feel safe or secure or whatever, it could just be something's off in the body that's making you feel that way in the situation. And we try to make sense out of it out here because that's part of the emotional response is like, hey, something's making me feel not stable. And so you look around, you go, well, it's probably all these people in here, or it's probably this room, or it's probably I can't get out of the door, or it's probably, you start going down the list, when really it's just the years are off.
Mm-hmm. It
Yeah.
makes sense. And what you said about the sternocleidomastoid, I mean, I always have issues with those things. My neck muscles are always extremely tight, and
Yeah.
I'm always working that. And when you talked about it down into the clavicle, I was like, well, yeah, my
Yeah.
therapist actually was just working in there, and it was like, oh my God, what is going on there?
Yeah.
So
So see if you have a little bit of a predisposition, it might be more your inner ear than it is
yeah,
that you have a phobia.
right.
It really could be literally like, because if you think about it, like it even would manifest in a car or
Yeah.
uh like when I was younger, I was freaked out about like if I was to start skating or got in a canoe or something, I was like, I'm just gonna tip over. And I usually would. Even when I would try to ski, I was like, this feels super weird. Years later, I realized from a neck injury, like I have an inner ear issue, and went through and resolved that. And I would say I had a really bad fear of heights when I was young, and no reason. Like it wasn't like I had a bad incident or anything. I was just, any of those kind of activities would always freak me out. But it was an inner ear issue. It wasn't because of a trauma. It was just my body didn't feel safe.
Yeah. Cool. Thank you
Yeah.
so much.
Yeah, you're so welcome. Interesting thing for you to explore. Like I don't know.
Yeah, definitely.
Yeah.
Definitely. And I'll try it with the vetiver right away and see what happens. If not, I'll
Yeah.
just go with the dark blue tansy.
Yeah, and maybe try the vetiver, and I'll see. I'll do some experiments and see if I can find a different thing. And you probably have something else that will work. I just got to go through and figure it out.
Okay, no worries.
Yeah,
Okay, thank you.
you're so welcome. You know what might work? Allergy support.
Allergy support. Okay.
Yeah, because it kind of does. It kind of does that same thing. It has a little bit of tansy in it, blue tansy, but it's to make like the area to be non-reactive, and that's what the blue tansy is doing when you inhale it and you're directing it into the ears. Try the vetiver, but also try, vetiver is very good for resetting the limbic system, like the vagal tone for the limbic system. So that's why I say like vetiver. But then the allergy support, kind of is in the vein of what the dark blue tansy would do. So even do a little experiment with that, where, jaws and ears and the thing that I notice when I go and do that work on the inner ear is it makes the solar plexus, the navel, and the main men expel. Like, kind of regulate that. And then like those lower centers just go, bleh. And then, I'll kind of go through and clean them up. And then I go, well, that was interesting. And then I do it again. And it takes this like weird tension out of the body that I don't know that I even knew that it was there until it was gone. And then I'm like, yeah, that's been a thing for a while.
Yeah. Excellent.
Yeah.
Okay, I'll let you know.
Okay.
And then go ahead, Channing.
Hey, Jenny.
Hi, Greg. I actually haven't talked to her yet. I tried to call back and then she
Oh,
didn't.
gotcha.
So, but I actually have a question for you.
Mhm.
So Wednesday is my phone call with that recruiter.
Oh,
And
yay.
right, yeah. Exactly.
Talk about the Illuminati a lot.
I would if I knew more about it, actually.
Yeah.
Should I be nervous that I'm not nervous? Like I'm so
No,
used to getting nervous, but now I'm not nervous about that. I know it sounds so neurotic.
I mean, if you're nervous that you're not nervous.
I am
Yeah,
because
yeah. No,
four and a
I've
half
been
years
there.
ago when I was in this
Yeah.
situation, I had to muster up every part of like my soul to just get through and prepare. And it
Mhm.
ended well, and I knew that it was going well when it was going well. But it was just like, oh my gosh, it's like I had to like pull myself along. Now I'm
Mhm.
just like, I don't know. I'm not exactly sure. Like I started preparing, just kind of going through like,
Mhm.
just the framework of how do you answer this question or what do you really want to focus on and blah, blah. So I wanted to see if there's something that you might say about that. And
Yeah, I think that's fine. I mean, I used to kind of joke about that for myself. And uh I think I used to say, I'm upset that I'm not upset about this. And when you do all the kinds of work that we do, it does shift out of a reactionary mode. And you're now starting to go to a place of responding versus just reacting. And that is it's kind of like what we were talking about in the instinctive support in the Auric program, where, we're so used to just having a response and not really knowing why, or like, oh, I got to calm down, or I don't know why I said that, or I don't know why I did that, or I don't know why I'm nervous. And like when all these things start calming down, you have like more time to cognitively like kind of process things, and you get to make choices, and it is kind of weird because you don't have those normal responses like you used to, and like how you see other people might be doing. But I would say it allows for a greater level of perception, adaptation, and like focus. And so, even when I was young, like when I'd be doing certain tasks, or, doing some sort of competition or something, if I was calm and clear like that, I usually did really well. But if I wasn't, I might do good, I might not. It's hard to say, but like, there's almost like the ability to bring something forth in that place. It's not just being blown around by the wind, so to speak. And so you know you know the stuff, and like you said, when we were talking about it, they throw weird questions at you, this particular company, and I would still do the best that you can, but I think we're always in this place of just reacting, and that you can spend time like kind of thinking it out. um I don't know. I think it gives you a better shot. And if it's not a good fit, it's just not a good fit. But, you know,
I'm actually excited about it because this
Mhm.
time she actually sent me a job description,
Oh, nice.
where last time she didn't.
Yeah. Uh, when is it? Wednesday?
It's a call with her on Wednesday. I
Yeah.
think it's just more like a touch base. I see it as like another screening call, although she's already screened me and I didn't move forward with it last year. I wasn't ready to make any moves.
Yeah. Work that oil for the aspect of Jupiter.
Oh, that's so
And
funny that you should say
yeah.
that because I'm touching that right now.
hmm Yeah. Work
I have
that.
that whole pattern out too.
Yeah. Work that, and then just go in there and be yourself.
Okay.
Yeah. I had these two little nieces, and whenever they were like going for their first job, I'd always go, don't make any eye contact, don't do this, talk about the Illuminati, and I would just kind of joke and tease with them just to kind of take the edge off. But you know, if you get over the nerves and you're in that place where you feel kind of calm, I mean, that puts you in a very good place. It also makes you look like you know what you're doing, and you're very professional, and you know you're also not desperate, all the things. And if you think about it, you're also in a very different place right now. You're not just needing to jump into a job. You got all these other side projects you got going on, and so people want to do business with people who are successful. And when you're going into the situation calmer, you're behaving like somebody who's successful. And so, you know kind of a good place to be.
Thank you.
Yeah. Yeah. Good
Um,
for you.
what?
I said good for you. Yeah.
Thank you. The Auric pattern that we just did, is
hmm
there anything you had mentioned the healing spirit, so I'm with you on that point with Jupiter. Is there
hmm
anything you want me to do differently in what we have been working on together?
No, I would say just the things that we talked about for that blend, and for the Jupiter part. Yeah.
Okay, that sounds
Yeah.
great.
And
Thanks.
and then even a little bit of this the pattern
And
that we did tonight for the org programming. Yeah.
that's exactly the pattern you told me to
Yeah.
use
Yeah.
before. Okay, and I'll throw in the angels as well.
There you go.
Angels, right?
Yeah.
Okay, thanks,
Yeah.
Greg.
You're so welcome.
So we have some questions and shares that came in.
Mhm.
I think you recommended either Roman or German chamomile for bug bites, but I'm not sure which. Would you please speak to the difference between the two?
German chamomile is a little bit more anti-inflammatory and stimulates more white blood cells and kind of cleans it up a little bit better. The Roman chamomile does it somewhat as well, but still more antispasmodic and anti-inflammatory, and so that will work. The thing that's kind of nice about the Roman chamomile is it's not quite as messy as the German chamomile. You know, the German chamomile is dark blue, and you put a little bit on the bug bite, and then you get a little bit on your face, and you know, it's everywhere. But both would work. Lavender can also be helpful in those kinds of situations, especially if it's not too bad of a bug bite. The thing that I like also about German chamomile is you could even take a drop or two of the German chamomile. You could also do a couple of drops of like blue tansy, because a lot of times when we have the reaction to the bug bite, the inflammation and everything, it's kind of in the vein of an allergic response. And so a lot of times if you give somebody like a Benadryl or like I use quercetin, you know, give somebody quercetin and the body, you know, reduces the levels of histamine, but part of an allergic reaction or inflammatory reaction is still, you know, a heightened fight flight response. You know, it's just different. It's not like you're feeling anxious, but your body's feeling anxious and reacting to those things going on in the body. And so with that, the quercetin is helpful. The German chamomile is helpful to reduce that. Dark blue tansy is also helpful to reduce that response. Another one that you wouldn't think of that would help that, not so much the bug bite itself, but the allergic kind of potentials in that is Neoli. You know, that one that kind of smells like a eucalyptus, but it's not, Neoli. And you know, put several drops on your wrist or on your chest or something like that. But if you can reduce that response, even if you get bit, the body won't swell up or have the reaction quite as much. You know, there was a really bad breakout of bed bugs on the East Coast, and this is many years ago, like probably a decade ago. And you know, I had a whole bunch of people call me at once, like, what, you know, what oil to use, what should I do, and everything. I just had them start throwing down quercetin, and all the symptoms went away. Like, you know, they still got, you know, some bites, but they, you know, or whatever reactions they were having, but within a dosage or two of the quercetin, it went away, you know. So, you know, that's always a thing with any sort of bug bite is, you know, reduce the inflammatory response, reduce the allergic response, and it usually will resolve itself and not be itchy, not be painful. The swelling will start reducing, you know, all those things.
Thank you.
Mhm.
I don't always share these, but I liked this perspective because we're kind of troubleshooting with Ralph and the little
Mhm.
3-year-old.
Mhm.
And this came from a mom with 2 little kids. So they just said I would not probably go down the route of trying to repel the 3-year-old right when the mom is trying to stop nursing. That's going to doubtfully distress the kid. Kid needs oils to calm and soothe so they can feel calm despite the milk going away. Mom needs to cuddle and bring the child close more than away to reduce the upset and the change. Otherwise, the kid will keep automatically reaching for the boob to feel better. And I actually kind of love that because it's
Yeah,
kind of
that's
like
great
just a
advice.
different
I mean, that's a mother's advice
approach.
right there.
Yeah.
Like, you know what I mean? So if you're looking for calming and soothing, lavender, mandarin,
The
chamomile,
yeah, so
Roman
like the little
chamomile.
children's kit could still
Yeah,
work, but it's
yeah.
for the
Oh,
kid
yeah.
to be able to
That's
like
a very
be
good
okay
perspective.
with not
Yeah, I like
having
that.
it.
Yeah,
So I
yeah,
just appreciated that to share.
yeah. In those situations, I can only imagine. You know what I mean? Like
Well, and you're
so
dealing with a
having,
3-year-old
yeah,
too, like all of those
having a mom
things, so
give some
many
advice
things.
is like perfect in this area.
Yeah.
Yeah.
Someone said, I'm really relating to Linda's hesitancy to go out into public. Could Greg repeat the protocol, please?
Yeah, I think she had done her little process. I can't remember all the things that she had done, but we were talking about using tarragon, rose, or benzoin, and then going for the perineum up the spine into the brain, and then the forehead, backhead, and then the idea of also um, inhaling dark blue tansy with your awareness like on the jaw in the inner ear. You could also do the upper centers, the crown, forehead, ajna, but definitely the jaw in the inner ear. And, um, vagal tone for the inner ear. Most people have an issue there, but some of us have way more of an issue there than others. And I don't know, I find that to be like kind of stabilizing to the body. And when you go out in public sometimes, you might be walking fine, but there's like a sense of like inner balance that might might be a little bit of a struggle. And so that idea of working the inner ear could be an issue, you know. And so Linda was working like Annis for her throat and swallowing and Gordaldo, and I can remember everything that she said she was doing. It was out of one of the processes out of the book, but I have to look them up like you guys.
And if you have that book, it is the physical and spiritual aspects of the vagus nerve.
Oh yeah. That class.
So it was
Yeah,
that class that
yeah.
had a specific protocol that she
Right,
was working.
right. Yeah, like what we're gonna do on that Father's Day weekend is kind of build on what we did in that class. So like take it deeper, but like more into your physiology and yeah,
Yeah, I said thank you
yeah,
so much.
yeah. And if you do the inner ear thing, let me know. Like I'm curious about that. Yeah.
I think we're caught up on questions. Do you feel like we could maybe try to play and see if people have any of those oils to kind of
Yeah, let's see if you have dark blue tansy or vetiver. Um, I do have to jump into that session in 5 minutes or so.
Yeah.
Okay.
So we'll literally do a 3 minute.
Yeah. We'll do like a little quick thing.
Tease them.
Yeah.
So
See what you have. You know what else might work is neroli. Neroli might work.
and if you have the plant teacher's kit, you definitely have some of those oils.
Yeah.
Just do a little quick sniff.
Okay. So start inhaling with your awareness on your jaws. Nice, long, slow, deep breaths. And then go to the ear canals, the holes in your ears. Now do the holes in your ears and your throat both at the same time. 3. Okay, if I share that.
Mhm.
So Samantha was saying, like every time that she does like jaw and ear, especially like going into the inner ear, it makes her low back release. She said like every time, yeah,
Mhm.
every time.
So why am I not doing it all the time? I don't know.
Well, there's an old osteopathic principle that the bones of your head mimic the bones of your pelvis. And so if there's an issue up high or down low, like, they correlate. The ears, the holes in your ears and your throat. Okay, and then let go. How did that feel? I know it was really tiny and short, but at least it's a little bit of an exploration. So thanks you guys for switching. We didn't want to just cancel because we were traveling tomorrow night and bounce around to a couple of different places, eventually ending up out in California for Astara. So, we're not doing our thing tomorrow night, and Wednesday night we won't be streaming because we'll also be on the road that night as well. So thanks for switching, and hopefully you can join us on the weekend. It's going to be, revisiting the angel encyclopedia class, the angelic encyclopedia, and I'm pulling together some more kind of preparatory information for you to go, not necessarily new angels, but just information about that whole angelic realm and things like that. And so, yeah, join us if you can. If not, let us know after the fact and we'll get you the booklet. So, okay, you guys, take care.